ఒళ్ళు నొప్పి, జలుబు, తలనొప్పి ఏమున్నా తక్షణ నొప్పి శమనం. శాస్త్రి బామ్, మీ కుటుంబ ఆరోగ్య రక్ష.
My name is Dr. B.B. Das. I work in care hospitals in Vizag. I am in practice in Visakhapatnam for last 25 years. I am trained in AIMS. Recently, we did one robotic surgery for a difficult case which is almost rare all over the world.
Sir, can you able to speak in Telugu?
Yeah, I can.
Yes.
The patient was having a disease called ulcerative colitis. In ulcerative colitis, the whole large intestine, Pedda Pegulu, is diseased, and the patient was complaining of bleeding through the rectum for last 3 years, and the patient was on steroid medications. So the quality of life was very poor. He went to multiple places. Even surgeons did surgery for his piles, thinking it as piles. So he came here. The treatment for this ulcerative colitis, usually Pedda Pegulu, whole Pedagulu will remove and will take the small intestine, Chinna Pegulu, and join it to the anal canal. Usually it is a open surgery, and from the Zyphus sternum right up to the pubis, whole we have to open, whole Pedda Pegulu we have to remove, and Chinna Pegulu we have to join it to the last portion of the intestine, that is the anal canal. And if someone is in steroids, this big incision that will not heal. It takes months to heal. They don't go out of the hospital. So usually surgeons don't do this surgery because the results might be good. The patient has to recover from the surgery. Recovery chala difficult. Usually surgeons will be afraid not to do. But with the help of robotic surgery, this is much easy. We don't have to cut open. First time in this part of the world we didn't cut open. We only use small little holes. The robotic instruments will go. The surgeons will sit in a different place, but the instruments will work on the patients. And the instruments will work very precisely, will go to the right location. So without injuring adjacent structure, it will remove the whole large intestine. With the machines, the joining between the large and small will be done without cutting open again. And at the end, you can see in day 7, the patient is walking around, roaming around, and is ready to go home, eating well. He does not have to take any more steroids because, as you know, already the disease bad part is gone. So, coming back to robotic surgery is practiced in America and South Korea for years together, in which the robot does not operate. The robotic instruments, which are very precise, they went through small teeny holes inside the abdomen painlessly. I repeat, painlessly. So they go to the exact part where is the problem, whether it is a tumor, stone, and they remove that and they come out. At the end, by the end of the day, morning I do surgery, the patients are walking and they're going to the home. And next day, they're telling, send us home. So there are no cutting, there are no big holes, painless, no bleeding, and they are going home next day. And everybody must be thinking, chala costly, this procedure must be very costly. But if you stay more day in the ICU and spend lakhs of rupees in antibiotics and staying in the ICU, that cost is compensated if you do by robotic surgery. So I believe that robotic surgery is almost same cost that of open and laparoscopy. Only thing, more and more doctors should be trained in it so that they can do it. So that inhibition, that feeling that we can do it open, why go for a robotic, that should go. If that will go, more and more number of patients will get benefited with almost same cost. They will have pain free, they will have no scars, they will have no bleeding, they will have less complications. In cancer, the tumor can be removed more completely. What more we need? Without cutting open, as if a surgery is not done. If someone asks me a surgery, even a smallest one, I'll think twice. So also all of you. So this robotic surgery has transformed the surgery in such a way that we are doing as if no surgery has been done. So I wish more and more surgeons get trained, the awareness increase, and whenever unfortunately someone needs a surgery, let it be done robotically. I believe what can't be done robotically can't be done by open surgery, because robotic surgery you get 10 times magnified view. If you see my finger like this in robots, you will see 10 times better. And the hand movement, what I am able to do, that the instruments do exactly. With laparoscopy, you can't do that. With open surgery, you can do, but you such a big cut, the recovery is delayed, ICU stay is more, antibiotic is more. So why open? Why laparoscopy? We should adapt and practice more and more robotic surgery so that more patients get benefited and go home early, safely, pain-free, as if a surgery has not been done. Thank you.
So this
So
is the
what
first.
kind of motivation need to patients before surgery, sir?
The patient must know that the surgery is not done by a robot, it is done by a surgeon and with the highly skilled robotic instruments. Number two, it is not a prohibitively costly to them, and they must know that this is much, much safer, and this is no pain is there, as if there is no incision is being given, so pain-free, bloodless, safely they are going home. What more they need? So that motivates them. Every time I tell someone that you are going home next day pain-free, they are very happy. Even 90 years we have operated, they walk down the home next day. So that is the beauty of science, that is the beauty of robotic surgery.
Results allow nice, sir.
The results are extremely good. They are going almost in last 1 year, February 3rd, 2024, we started robotic surgery in Vizag for GI surgery. And in a year, we have done more than 500 surgeries. And all the patients are happy. And because they are happy, we are getting almost every day more difficult cases. They want, can you do robotically? Yesterday, in Srikakulam, someone is having a big gastric tumor. They want an opinion. Can you remove it robotically? Yes, we can. The magic of robotic surgery should spread to more people so that they go without a scar and pain-free and safely removing whatever disease is inside and it needs surgically to be removed.
Any complications is there?
Complications depends on the surgical skill. As such, if you see, the robotic instruments are more precise, so the complications are minimized. With open surgery, if you have a 100% complication, with laparoscopy, you will have 50%, you will overtake, you will have 5%. So what will you choose? The least complication with robotic instruments. Because my hand might tremble at time, my mind may not work all the time. But robotic instrument work only when the surgeon is attentive. The moment I am little unattentive, the instrument stops.
Yes.
So robots prevents us doing any human errors to the maximum. That's why robotic surgery is better in the hand of a surgeon.
Right, sir. Thank you.
Thank you so much.
మరిన్ని వీడియోస్ కోసం ఛానల్ ని సబ్స్క్రైబ్ చేయండి. లేటెస్ట్ అప్డేట్స్ కోసం వాట్సాప్ ఛానల్ ని ఫాలో అవ్వండి. ఆ లింక్ డిస్క్రిప్షన్ లో ఉంది.